everyone, welcome to Unacademy NEET platform, and today's topic of choice is cardiology. My name is Dr. Capital A, and I am from Delhi. And today we're gonna talk about the pediatric cardiology part. Now it's a test of pediatric cardiology, top 100 MCQs of pediatric cardio. And for the newcomers, this is the Unacademy NEET PG platform. And first of all, I would like to congratulate to our amazing FMG December toppers of 2021 batch. They have worked really hard. That is why their faces they have worked so hard in their exam, and that is why they are here today. So a very beautiful congratulations to our dear amazing toppers of FMG December 2021 batch. And now the NEET PG counseling has already started, and the 12th March is our exam also. And hello Nishi, hello Asama, hello Vaidehi, Hamid, Robin and Sandhu. Very good. कैसे हैं आप सब लोग? खाना खा लिया, लंच कर लिया सबने? अभी नहीं किया, आपने कर लिया? So we have a free test calendar, guys, of medical PG prep. All these dates we have amazing, what you call MCQs test we have, and I recommend every one of you to participate. So if you want to top in your exams, and also at the same time for the newcomers, we have something known as plus subscription in an academy and something known as iconic subscription in an academy. In the plus subscription of an academy, number one, you get all the access to our live and recorded classes. Number two, we get to study from the best educators. Number three, we get to participate in a lot of free MCQs, test discussions. And number four, as you're watching me on your iPad, on your laptop, on your computer, everywhere you can watch me. This is the plus subscription. And we have the iconic subscription. In the iconic subscription, what do you get? Nothing you get. Only you get is an academy subscription, and the what you call prep ladder. The prep ladder subscription, basically we get all the clinical notes, video lectures, question bank, rapid revision and treasure notes. Everything you get on the iconic subscription, like your access to the best from the two of the best, right? That is the iconic subscription. Anji, Steffi, hello Steffi, how are you? Nice name. So, and we also have a special class feature which is there on the Unacademy app, where we make a lot of MCQs polls, and it's easy to crack exam that way. So I recommend you to download Unacademy. And also we have the best of the best question bank. And at the same time, we have already made a batch of the Focus FMG 2022 and Target NEET PG 2022 batch, which is going mind blowing. Okay. And also at the same time, this was the plus and the iconic subscription. And if you want to take the pack, it will be easy for you to take it. And if you want to use any code, this is the code for today. This code, if you use it, Dr. Anand, it will be a little helpful for you. And also at the same time, yes, let's start the mind blowing, super fantastic, super से भी ऊपर वाला test. Let's start it and let's see कितना आपको याद है, how much do you remember and how much you don't remember. And yes, we have the 100 MCQs. And before starting any wonderful mind-blowing super hit session, we always have a motivating quote, and today's motivating quote is a very nice one. So the quote is, expect less and accept more. Expect less and accept more. Judge less and respect more. Judge less and respect more. It's a nice quote. So the thing is, what is it? Expect less and accept more. Judge less and respect more. Complaint less and thank more. Complaint less and thank more. And last, regret less and smile more. So this is the funda of life. And now someone will say, कहना बड़ा आसान है, करना बड़ा मुश्किल। लेकिन बेटा, वो कहते हैं ना कि हार के जो जीतता है उसे बाजीगर कहते हैं। तो बाजीगर हर कोई तो बनता नहीं, वही बनता है जो ये सब फॉलो करता है और खुश रहता है, उसी को बाजीगर कहते हैं। हर कोई अगर इतनी आसानी से करने रह गया तो हर कोई बाजीगर हो। So that's what. Okay, yes, Dr. Priya, yes. No expectation, learning from the morning class. Yes, my dear, that's true. So Robin, yes, judge less and respect more. Very true, bro. ठीक है, चलो आगे बढ़ते हैं. Let's start this beautiful session. Okay, now this session is a very important session. We're gonna cover huge MCQs on a very high level base MCQs. We're gonna cover. Let me increase the width of my pen. Okay, little bit I've increased. Okay, Anji, I am a 5-month-old baby. I am a 5-month-old baby. Tell me which congenital heart disease is common in my case. If I have shown you this picture of the baby, then the question is which congenital heart disease is common in this case. The only highlighter I can give you right now is the baby is having micrognathia. Micrognathia. The options are atrial septal defect, ventricular septal defect, patent ductus arteriosus, and our transposition of great arteries. So, what do you think, guys? What have you done? Okay, which answer? Okay, let's dissect one by one. So, I mean, the first question is that which congenital heart disease is this? Like, which syndrome is this? If I zoom little, then which syndrome does this baby land up into? If I say this baby is having micrognathia, and if I say this baby is having difficult bag and mass ventilation, difficult bag and mass ventilation is to be done for this baby. If I say glossoptosis. Now tell me first of all which syndrome is this? Now this paper, I have made this paper and it's like tongue twisting paper. You need to know the syndrome first. Which syndrome is this? Yes, Steffi Vishwakarma is very right. It's a Pierre-Robin syndrome. Very good. It's a Pierre-Robin syndrome. Yes or no? What are the important points of Pierre-Robin syndrome? So point number one, the patient will have micrognathia. The patient will have difficult bag and mass ventilation. This patient can have a U-shaped cleft palate. Yes or no? Can this patient have a U-shaped cleft palate? Yes, he can have it. And also there will be glossoptosis. So this case is nothing but a case of Pierre-Robin syndrome. Pierre-Robin syndrome. Do you remember we have done in our what you call in our dentist wala the segment dentition the causes of the natal teeth? Have you and can anyone remember what are the causes of natal teeth? See now this class, okay, glossoptosis means downward and backward displacement of tongue, downward and retraction, the backward displacement, or I would say retraction. So downward displacement and retraction of tongue is known as glossoptosis, happens in Pierre-Robin syndrome. So can anyone say now this class we have to do a multiple integrated approach. What are the causes of natal teeth in a newborn? A newborn baby having teeth. What are the causes? Does anyone remember we have done a mnemonic something known as PEACE? P for Pierre-Robin syndrome. Yes or no? E for Elise Van Creveld syndrome. Yes or no? Kara hai ya nahi kara hai? In the previous classes we have done this. And another E is epidermolysis bullosa, and S for Soto's syndrome. These are the four important causes of natal teeth, a newborn baby having teeth. So first one is nothing but Pierre-Robin syndrome, and the important highlighters I told you. The Pierre-Robin syndrome will have micrognathia, retrognathia, difficult bag and mass, and glossoptosis very importantly, and U-shaped cleft palate. The most common congenital heart disease in our what you called this one Pierre-Robin syndrome is atrial septal defect. So the best answer for this question is nothing but atrial septal defect. समझ में आया या नहीं आया? Very good. Yes, that's right. So people who have answered right are our Nishi Agarwal and our, yeah, very good. Savan Singh also very good brother. So atrial septal defect is the best answer. Coming to question number two. Very good question. Let's see. The first recorded account of a congenital malformation of human heart was done by whom and in which year? Now there are no option for this. You have to tell only one single line answer. ये जो बड़ी गंदी आदत डली हुई है सबको, भाई हाँ ऑप्शन बता दो ABCD क्लिक कराएंगे. So don't have this bad habit of doing ABCD. Try to tell the answer. हाँ जी. By first recorded account of a congenital malformation of human heart was done by whom and in which year? Any random guesses? Anyone wants to give a wild guess? Okay, anyone? Hanji, we have so many people. Tanu, Raghuvansh. The best answer for this question is nothing but very importantly. Now, please read this one. The first recorded account of a congenital malformation of a human heart was done by Leonardo da Vinci. Leonardo da Vinci in 1513. Steffi Vishwakarma, very good, very what you call nice of you that you tried. And Dr. Savan Singh is another level. He said, I only invented the congenital malformation of heart. Dr. Savan says in 2013 he invented, bro, very nice thought, but that's not the right answer. The first recorded account of a congenital malformation of a human heart, recorded account of a congenital malformation of human heart was done by Leonardo da Vinci in 1513. ठीक है? Is that Da Vinci? हाँ जी, it's Leonardo da Vinci. That one only. That one only. Yes. Hamid says सावन 13 is right. सावन तो हर जगह सही है. कल सावन लेके आया था वो he got us yesterday night. I had my night duty. Got chole, aloo puri chole. Then he got Afghani chicken and then some gravy also he got. It was nice. Thank you, Savan. Bless you. A lot of love from my side. Question number three. The criteria to diagnose the presence of a congenital heart disease is known as anyone, which is the name of the criteria to diagnose a congenital heart disease. So what will you answer and come? Even my doggy Oscar also can answer this question. क्या है आंसर इसका? शुभांगी कौशिक. हाँ जी, छोले लाया था. Yes, हमें छोले सफेद छोले. And the criteria to diagnose the presence of a congenital heart disease is known as NADA's criteria. Is known as NADA's criteria. Very good. So the question number 3, the answer is NADA's criteria. Question number 4. Which of the following, let me just little zoom it for you. किसी की आंखें कमजोर हों तो ऐसे भी चल सकता है. Which of the following is not a major criteria which was asked in the previous question? Which of the following is not a major criteria which was asked in the previous question? In the previous question, we had asked about the NADA's criteria, right? So, which of the following is not a major criteria? So, anyone, what is not a major criteria? Number one, systolic murmur grade 3 or more is a major criteria. Diastolic murmur, yes. Cyanosis, yes. Congestive heart failure, yes. Systolic murmur less than 3, yeah. This one. The question number 4, the answer is E. That is not. This one is option number E is not a part of the major criteria. It is a part of the minor criteria. Yes, that's right. Very true. People who have answered wonderfully are Steffi Vishwakarma and Hamid Sandhu, Osama Tannu, Raghuvansh Vedahi, Nishi Rohini, Robin, our dear Robin, and Savan Singh. सावन में लग गई आग, वो गाना भी था ना. Which of the following is not a minor criteria of NADA's criteria? Question number 5. Which one of the following is not a minor criteria of NADA's criteria? We have this beautiful options. क्या जवाब देंगे आप? Will you write option A? Write option B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. What is the best answer? So which of the following? Yeah. So the options are systolic murmur less than grade 3, abnormal S2 heart sound, abnormal ECG, chest X-ray, abnormal BP, or Himalayan P waves. The question is that which one of the following is not a minor criteria. So question number 5, what is the best answer? So yes, everyone has the beautifully answered. Yes, Savan, Raghuvansh, Nishi, Shubhangi, Savan, Robin, Priya, and Hamid. Very good. The people who are participating are damn mind blowing, and you will get a seat. करके दिखाएंगे. हाँ भाई, हाँ. So Himalayan P waves is not a criteria of the minor criteria of the NADA's criteria. These all, see, this is a very important question paper, my dear friends. It's like a learning thing only, because option number A to E are all the minor criteria for NADA's criteria. So option number F is not a criteria for minor criteria. And Himalayan P waves, where do you see Himalayan P waves? You see Himalayan P waves in at Savan's house. Okay, Savan के घर पे बैठती है Himalayan P waves. So you see in Epstein anomaly, Himalayan waves are seen, and also in the cases of tricuspid atresia. In a cases of tricuspid atresia, you see Himalayan P. Question 6, a very easy one. Most common congenital heart disease in full cardiology. ASD, VSD, PDA and TGA. Which is the most common congenital heart disease in cardiology? क्या जवाब देकर आएंगे आप? Tell me. हाँ जी. रोबिन क्या एबनॉर्मल ईसीजी में आएगा ना हिमालयन वेव्स? नहीं ऐसे ब्रो, एबनॉर्मल ईसीजी तो कुछ भी हो सकता है, बट इज हिमालयन पी वेव स्पेसिफिकली अ क्राइटेरिया फॉर कंजेनिटल हार्ट? हिमालयन पी वेव्स इज नॉट अ क्राइटेरिया फॉर कंजेनिटल हार्ट, राइट? एबनॉर्मल ईसीजी में आता है हिमालयन पी वेव्स, दैट्स वेरी ट्रू. बट एक बेसिक क्वेश्चन पूछा है कि इनमें से बेस्ट आंसर क्या होगा? एबनॉर्मल ईसीजी बेस्ट आंसर होगा कि हिमालयन पी वेव्स आंसर होगा? लाइक एबनॉर्मल, आई एग्री दैट हिमालयन पी वेव्स इज नथिंग बट एबनॉर्मल ईसीजी, बट द स्ट्रेट अवे हिमालयन पी वेव्स विल बी द बेस्ट आंसर. एक सिंपल देखो, एक होता है ऐसे पकड़ना और एक होता है ऐसे 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 पकड़ना. तो तुम ऐसे पकड़ लो, ठीक है? हिमालयन पी वेव्स, आइसोलेटेड हिमालयन पी वेव्स नहीं मिलता ना. सो दैट्स इट, एफ इज आवर बेस्ट आंसर. The most common congenital heart disease in cardiology is nothing but a VSD. Yes, question number 6. The best answer is VSD. हाँ जी, that's true. Robin, yes, my dear Robin, and Hamid, ये very true. Right answer. Robin, right answer. Question number 6. The best answer is B. Question number 7. Which most common acyanotic congenital heart disease in cardiology? क्या लिख के आएंगे इस क्वेश्चन का आप? What will you write for question number 7, guys? ASD, VSD, PD, and TGA. The most common acyanotic. So question number 7 is very easy. The most common acyanotic congenital heart disease is nothing but again our VSD. Steffi is right, Tanu is right, Robin is right, Priya is right, everyone is right. Anyone who is wrong? Okay, no one is wrong. Okay, good, very good. If you answer these 100 questions of cardiology, much of your things have will be cleared. So it's good if you answer. Question number 8. Most common cyanotic congenital heart disease at day 1 of life is what? Anyone? Which is the most common cyanotic congenital heart at day 1 of life? Question number 8. What is the best answer? The options again are ASD, VSD, PG and TGA. What is the best answer? सावन में लग गई आग says D. Okay, why the he D? कोई गलत बताओ आंसर तो मजा आए. हाँ जी. PDA. ओके, आगे बंदे आगे भी मुबारक. So Dr. Mani Prakash says PDA. No dear, PDA is not the what you called. First of all, PDA is a acyanotic congenital heart disease, dear. Okay, I'm happy you're doing mistakes. Mistakes are allowed because mistakes are a proof that we are trying. Please remember, PDA is a acyanotic congenital heart. PDA is a left to right shunt. I'm asking the most common cyanotic congenital heart. The most common cyanotic congenital heart at day 1 of life is nothing but a TGA. What is TGA? Transposition of great arteries. Question number 8, the best answer is D. Question number 9. Congenital heart disease with plethoric lung fields. Very beautiful question. बहुत ही लाजवाब question है. देखते हैं क्या आंसर करेंगे आप लोग. The question is once again, yeah, the congenital heart disease with plethoric lung fields are all of the following except. What is plethoric lung fields? Plethoric lung fields मतलब increase pulmonary blood flow. Plethoric means increase pulmonary blood flow. हाँ जी, रचना is right. क्या जवाब देंगे इसमें? कोई गलत आंसर बताओ तो मैं मान जाऊं. हाँ जी, congenital heart disease with plethoric lung fields are all of the following except. Okay. Yes. So plethoric lung fields means increased pulmonary blood flow. So in atrial septal defect, ventricle septal defect, patent ductus arteriosus, there will be increased pulmonary blood flow. Even in supracardiac TAPVC also, in supracardiac TAPVC, you will get increased pulmonary blood flow. You know, right? Why will you get in supracardiac TAPVC? I hope you know that. Let me just, once again tell you, what you called, right, everyone, why supracardiac TAPVC will have increased pulmonary blood flow? If this is our four chambered heart and this is the our superior vena cava, in a supracardiac TAPVC, the purified blood from the heart, from the lungs, basically through the pulmonary veins, they directly enter into the superior vena cava. Normally pulmonary veins enter into the left atrium, but here the pulmonary veins are entering into the superior vena cava, and this is known as supracardiac TAPVC. Supracardiac TAPVC. So more and more blood will go. Yes or no? Normally the blood is going from superior vena cava to right atrium to right ventricle to pulmonary artery. Now the blood is coming from the lungs also to the right side of the heart. Nothing but leading to increased pulmonary blood flow. Increased pulmonary blood flow. Hanji. Very true. Yeah, because more blood comes through pulmonary veins in the right chamber, and then yeah, exactly. बस बात खत्म. ठीक है ना? You understood, right? That's what. So increased pulmonary blood flow is what we need to understand. Okay, let me just minimize this 1 second. Yeah. Okay, chalo. The best answer, the congenital heart disease with plethoric lung fields are ASD, VSD, PDA, and supracardiac TAPVC. But the option is except. The answer is tetralogy of Fallot. Tetralogy of Fallot has a component of pulmonary stenosis. So once the pulmonary stenosis is there, there will be decreased pulmonary blood flow. Decreased pulmonary blood flow. ठीक है, done? समझ में आ गया? Yes, very good. Hamid is right. Figure of 8 appearance कहाँ? Yeah, supracardiac TAPVC will have a figure of 8 appearance. Tetralogy of Fallot will have a boot-shaped heart. Yes, that you should know. Question number 10. Congenital heart disease. Let me just minimize this one. Congenital heart disease with oligemic lung fields. Question number 10. Congenital heart disease with oligemic lung fields are all of the following except. So which one is not a oligemic lung field? This one. Questions हटा है sir. Question दिखा है sir. दिख रहा है sir. Question 10 दिख रहा है आपको sir. Okay sir. ठीक है. Question number 10. Congenital heart disease with oligemic lung fields are all of the following except. So which one is not the oligemic lung field condition? The options are pulmonary atresia, pulmonary stenosis, tricuspid atresia, tricuspid stenosis, Epstein anomaly, tetralogy of Fallot, and atrial septal defect. So anyone? Okay, let's see. Because in this webinar, I'm only seeing the people who are answering little wrong so that I can, what you called, help them out. Okay, everyone. Yes. So yes, we all know that oligemic lung fields. Matlab oligemic lung fields means decrease pulmonary blood flow. Yes or no? Decrease pulmonary blood flow. So when if this is a four-chambered heart and this is our pulmonary artery, so if I squeeze the pulmonary artery, nothing but pulmonary atresia, there will be decrease pulmonary blood flow. And if I say pulmonary stenosis, then also decrease pulmonary blood flow. If this is the tricuspid wall, if I squeeze this one also, the blood will not able to go from the right atrium to the right ventricle. So again, decrease pulmonary blood flow. So tricuspid atresia, tricuspid stenosis, and even in Epstein anomaly also. Epstein anomaly, tetralogy of Fallot. All these conditions will be decreased pulmonary blood flow except the atrial septal defect. Atrial septal defect, we all know that atrial septal, if this is the four-chambered heart and this is the ASD, atrial septal defect, this one is a left to right shunt, and more blood will go through the pulmonary artery. So this is nothing but increased pulmonary blood flow. Yes or no? So ASD, VSD, PDA, they all are increased pulmonary blood flow, because normally the blood is coming from the superior vena cava to right atrium to right ventricle to pulmonary artery. But in ASD, there is a left to right shunt. So the blood from the left side of the heart is also entering the right side of the heart. So more and more blood entering the pulmonary artery and to the lungs, nothing but leading to increased pulmonary blood flow. So that's why question number 10, the best answer is a atrial septal defect. Atrial septal defect, you will see plethoric lung fields, not oligemic lung fields. Very good. Rachna is right. Has everyone understood this much? Please put a like button right now. Please put a comment. You can give a golden heart or a black heart or a blue heart or a semi-lunar heart like a mitral heart. You can give समझ में आ रहा है इतना कि नहीं समझ में आ रहा है. We have done 10 questions, 90 more questions left. This session will be only for 40 to 45 minutes. Next session will be at what do you call, कितने बजे? 4:30 बजे, 4:30. Okay, let me zoom it. Let me zoom it. Easy peasy questions. I am a 25-year-old mother. I am a 25-year-old mother who has taken lithium during pregnancy. Which shape of heart my baby can land up into? Options are boot shape heart, box shape heart, egg on string appearance, figure of 3 appearance, and figure of 8 appearance. So, what is the best answer? Yes, yes, yes. Very good. So people who are answering mind blowing are our dear Nishi Agarwal, Savan Singh, Vaidahi, Priya, Shubhangi, Rachna, Mani, Raghuvansh, and Steffi Vishwakarma, and many people. Yes, if the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly, and the Epstein anomaly, the shape of the heart is box shape heart. Box shape heart. Question number 11, the best answer is option B. Option B. Okay. How should I calculate the cardiothoracic ratio according to the image given below? Nice question. Question number 12. How should I calculate the cardiothoracic ratio according to the image given below? Okay, I'll only write the options here. Okay, there are four options. Okay. Okay, it is A minus B plus C. Like, can you see? This is A, right? This is A, and this is B, and this is C. Is it A plus B divided by C? Is it A by B plus C? Or it is A minus B minus C? So what do you think? Anji, exactly. So cardiothoracic ratio, cardio, the maximum diameter of the cardiac and maximum thoracic diameter. So number one, this is my heart, okay? This one is my heart. So if I draw a straight line, like that, so this part is my right side maximum cardiac diameter. This side is my left side maximum cardiac diameter. So A is my right side maximum cardiac diameter and B is my left side maximum cardiac diameter. So A plus B is the maximum cardiac diameter upon C. What is C? Means from the two ends of the what you call the lungs. So A plus B divided by C. This is nothing but cardiothoracic ratio, right? Yes or no? So yes, A plus B divided by C is the maximum, cardiothoracic ratio is how you calculate. So A plus B divided by C is our best answer. Done. Question number 13. I'm gonna little zoom out because you can't see the question otherwise. Okay, yeah. Cardiomegaly. Cardiomegaly will be called if cardiothoracic ratio is more than what in adults. Very important. CT ratio, which we say no, cardiothoracic ratio should be more than dash in adults. Anyone? How much it should be more than we say it's a cardiomegaly? Options are more than 50%, 60%, 70%, and 80%. What do you think? Anyone? Any random guesses? What will you answer and come? Anyone? Anji, A, B, C, or D? For this one? Very good, very good. Who will answer? Who will answer? Yes, so question number 13. So question number 13, remember the maximum cardiothoracic ratio usually in cardiomegaly will be called if cardiothoracic ratio is more than 50%. More than 50%. If the cardiothoracic ratio is more than 50%, yes, the best answer for this question is option number A. Why, sir? Why not option number B? Because cardiomegaly, see, now listen very carefully, like I am a neonate with cardiomegaly, how much CT ratio should be elevated to frame as cardiomegaly? For the newborn, for the neonate, the CT ratio should be more than 60%. The CT ratio should be more than 60% for the neonate. But for the adults, it should be more than 50%. Very important, very important. Remember this, okay? These are very prime questions. These are only and only MCQs based questions which are important for exams. So CT ratio more than 50 in adults and more than 60 in neonates. That's what we need to know. Understood? Yes or no? Question number 13, the best answer is A, whereas question number 14, the best answer is B. The best answer is B. Okay, done? Very good. Okay, question number 15. Okay, question number, yeah, 15. Yeah, now tell me. One second, let me zoom out in thoda sa. Yeah. I am a newborn. I am a newborn born through normal vaginal delivery. Doctor is examining my umbilical cord. How many arteries and how many veins I should have in my umbilical cord? Question number 15. What do you think? Anyone? It's a very easy question. A, B, C, D. I think everyone knows about it. Yes, we have two artery and one vein. Yes or no? In normally umbilical cord, we have two artery and one vein. So two artery and one vein. A, B, C, D. D is the best answer. People who have answered wonderfully are Tanu, Vaidahi, Mani Prakash, Savan, Robin, Hamid, and Rita and Kalpana Lodhi. Very good. Okay, very good. Okay, अगर how do you differentiate artery from vein? Which is artery and which is vein? कैसे पता कि ये वाली artery और ये वाली vein है? How do you know which this one is artery and this one is vein? How do you differentiate? Anyone? Yes, very good. Very good. Artery will have a round lumen. Artery will have a round lumen, whereas vein will have a collapsed lumen. Yes or no? We have round lumen and the collapsed lumen. So artery will have a round lumen. Thick, yes, Steffi is right. It will be thick. Osama is also right. Robin is also right. And vein lumen will collapse. Let's say collapsed lumen. Okay, very good. Very good. Perfect. Mind-blowing answer you guys are giving. Wonderful. You will be the best of the best. I am a newborn with single umbilical artery. Question number 16. I am a newborn with single umbilical artery. What is the most common associated anomaly I will be associated with it? The options are A. Cardiac genesis, hepatic agenesis, genital agenesis, and renal agenesis. Question number 16. What do you think? Yes, very good. People who are answering best are Nishi, Steffi, Rachna, Shubhangi, Mona Lisa, Kalpana, Savan. बहुत सारे हैं मुझसे बोला नहीं जा रहा बहुत सारे लोग हैं तो रीनल. Yes, if a baby is having single umbilical artery and single umbilical vein, you will rule out renal agenesis. Renal agenesis, very good. Mind-blowing answer. 30 minutes over, 15 minutes left, then this class will be over. Total 100 questions we have to do. The rest half we will do at 4:30 session. Okay, name the findings shown below. Okay, let me zoom it. Let me zoom it. 1 second. Yes. नेम द फाइंडिंग शोन बिलो. आई विल नॉट गिव यू द ऑप्शंस. आई मेरा मूड नहीं कर रहा मेरा. मैं खा गया ऑप्शन में खा गया. What is the answer for this question? If you are not given option in this, what will you say? Name the findings seen in the image. Anyone? Any random guesses? What is the what can we see in this picture? Anyone? Any random CRT? Okay. Rita says CRT. Anything else? Anything else? Anyone else? By mistake, any other random guesses you can make? Okay, if I give you a hint, the hint is this one. This is the hint. What is this? Okay, dorsal pedis palpating. ठीक है. ऑप्शन में ऑप्शन में फैट होते हैं फट. Okay, rocker bottom feet नहीं. I'm happy that Steffi is trying to answer. So okay, still anyone dorsalis pedis नहीं. अच्छा ऑप्शन ना दो तो चक्कर ही आ जाता है. साफ साफ नजर आया तो ऑप्शन पे डिपेंडेंट हो तुम लोग तो. ऑप्शन नहीं मिला तो बस बत्ती गुल. Okay, so again, I will not tell you the option. I only give you hint. First hint was there is a gap. There is a gap between the great toe, first toe, and the second toe. There is a gap, this. There is a gap between the great toe and the second toe. What will you say? Anyone? Okay, Alina Vani says, "Hello, sir. Your lectures are the best." Thank you. That's very nice of you. God bless you. May God give you a lot of sweets, and may God give you a lot of sweets, and you don't get fat also. That my wishes are there. And yes, very good. So this is nothing but sandal gap. Very true. Question number 17. The best options we have is plantar grasp, sandal gap, toe gap, normal gap, none of the above. The answer is nothing but sandal gap. Sandal gap is the gap between the, very importantly, between the great toe and the first toe, great toe and the second toe. This gap, ye wala gap, this gap. This is known as sandal gap. Okay, sandal gap, yes or no? Will you remember this? I will shoot you with a gun if you don't remember this. You must remember this. So where do you see sandal gap? Sandal gap you see in Down syndrome. You see in Down syndrome. Sandal gap, which is trisomy 21. Trisomy 21. Okay, done. Very good. Let's move further. Okay. Anji. Okay, let me zoom out little bit. 1 second. Yeah. Question number 18. Which is the most common congenital heart disease associated with the findings seen in the image? So the findings seen in the image is nothing but again our sandal gap. Sandal gap is seen in Down syndrome. So they are asking which is the most common congenital heart disease in Down syndrome. So options are A, B, C, D. Ventricular septal defect, endocardial cushion defect, patent ductus arteriosus and transposition of great arteries. So क्या लिख के आएंगे आप? क्या अपनी बेइज्जती करा के आएंगे आप कुछ लिख कर आएंगे, आप रैंक नंबर 1 लेकर आएंगे, क्या लेकर आएंगे आप? What do you think, anyone? Okay, very good, very good, very good. Yes, the most common congenital heart disease in Down syndrome is nothing but ostium primum. Ostium primum type of atrial septal defect, and the most specific is nothing but endocardial cushion defect. The most common congenital heart disease in Down syndrome is nothing but ostium primum type of atrial septal defect, and the most specific is endocardial cushion defect. People who have answered wonderfully are Kalpana Lodhi, Sai Raghuvansh, Sarika Hamid, Rashna Vedhi, Shubhangi Mani, Deepak Nishi Priya, and Sai Pavan Palla with Steffi and Rita. Very good. Beautiful. Beautiful. Very good. Question number 19. True or false? Blood in the inferior vena cava has more saturation than blood in the superior vena cava in fetal circulation. I'm asking about fetal circulation. Is this line true or false? In the fetal circulation, the blood in the inferior vena cava is more saturated than blood in the superior vena cava. Is this line true or false? Anyone? People who are answering right are again Sarika, Nishi, Rachna, Steffi, Raghuvansh, Priya, Shubhangi, Mani, Tanu. Yes, this is a very, very true statement. In the fetal circulation, we know that like we have two arteries and one vein, right? Like remember in the fetal circulation, right? So we have like if this is the baby and this is the placenta, this is the placenta, okay, this is the baby. Let me make the Savan's face. Okay, this is Savan. Okay, this is a Savan baby. Okay, so now the deoxygenated blood basically enter goes from the baby to the placenta with the help of two umbilical artery. Yes or no? Umbilical artery carries the deoxygenated blood. Yes or no? It's an exam question. Star mark. Umbilical artery, there are two arteries and one vein. Umbilical artery carry the deoxygenated blood from the baby to the placenta, and then what happened? There is mixing of the blood takes place in the chorionic villus and ochronic sinusoids. And what happens? Then there's two artery and one vein. That nothing but umbilical vein carries the oxygenated blood from the placenta to the baby. And once he enters the baby, number one, it enters the liver, right? So no, it enters the liver, and we have a bypass channel here. What is the name of the channel? Nothing but ductus venosus. Ductus venosus. Okay, it is a bypass channel. Above the ductus venosus, what do you have? We have inferior vena cava, and below we have umbilical vein. It's another exam question. Ductus venosus is a channel between what? It is between the inferior vena cava and umbilical vein. Okay, so the oxygenated blood once enters the baby, it bypasses the baby, it enters the baby liver, but it has a bypass channel basically, that is ductus venosus, and then the blood goes into the inferior vena cava, and then it goes inside the heart. heart. So compared to superior vena cava SVC and inferior vena cava blood is more saturated, more oxygenated than the superior vena cava blood, Done? Yes or no? Very good. Has everyone understood this much? Put a like button if you have understood, or a comment that you have understood. Yes or no? Staphylococcus, शुभांगी, निशी, समझ में आ गया कि नहीं समझ में आया? दिमाग के ऊपर से जा रहा है? हैं? रोटी खानी है, सब्जी, लंच करना है, चक्कर आ रहा है? Anyone having hypoglycemic? Very good. Okay. So perfect. Perfect. Okay. Question number 20. True or false? In the fetal circulation, placenta is a high pressure system, and after the baby is born, aorta is a high pressure system. Is this line true or is this line false? What do you think? Anyone? Yes. Very Hamid, जिस तरह दिल देता है ना, इतना प्यारा, बड़े colorful hearts Hamid gives. Thank you, bro. And Steffi also very nice heart. So a baby can make a cross. The like the heart which you're giving, no, it has a cross. So milestone you should know. A baby can make a cross by anyone 8 years. A baby can make this cross by 8 years. Okay. Hmm. ठीक है, done. Okay. So in the fetal circulation, placenta is a high pressure system. That's very, very true. This is a true line. Placenta is a very high pressure system in the fetal circulation. That is why, remember, my dear friends, please remember that in the fetal, if this is the heart, no, this is the heart. Okay. So placenta is a high pressure system. Placenta is a high pressure system. So that is why once the blood from the placenta to the umbilical cord enters the baby, remember, once it enters the right atrium, there is a foramen ovale, and here the shunt will be right to left. The blood will go from right to left. Again, some blood which is left and which is go to right ventricle and then to the pulmonary artery, and normally this blood should go to the lungs for the purification. Yes or no? But lungs are never functioning. The lungs are collapsed. Lungs are not functioning. So this blood basically it enters from the ductus arteriosus. Why? What will it will do? The blood from the right ventricle goes to the pulmonary artery and then enters the ductus arteriosus, and then it enters the what you call aorta. Yes or no? So this shunt is nothing but right to left. Can we understand that in the fetal circulation the ductus arteriosus is nothing but it is a right to left shunt? It is a right to left shunt. The ductus arteriosus basically it is a right to left shunt. Okay. ठीक है, समझ में आ गया? Yes or no? And once the baby is out, and then this shunt is nothing but it is left to right. Once the baby is out, this shunt is left to right. Understood? Done. Let's move further. Yeah. Question number 21. Which congenital heart disease? हिल क्यों नहीं रहा? Question 21, which congenital heart disease is more common in the image shown below? Which congenital heart disease is more common in the image shown below? Question number 21. This is a very good question. मान जाऊंगा मैं. If you have thoroughly revised my sessions, then this is something you need to answer. Anji, what do you think? Anyone? Which congenital heart disease is associated with the image shown below? Now what is this image? Options are A, B, C, D. Osama, Rachna, Raghuvansh, Staphylococcus, Steffi, Indian Academy, and what do you call it? Yes, very good. Anyone? What do you think? What do you think? C, okay. The options are ASD, VSD, PD, and TGA. The first thing is like, क्या ये syndrome कौन सा है? Which is this syndrome? Who will tell me? Who will tell me? Who will tell me? Who will tell me? Which is the syndrome? नाम क्या है? क्या लिख कर आएंगे आप? अपनी शक्ल बना के आएंगे? अपनी फोटो बना के आएंगे एग्जाम में? What will you write? Anyone? What is the name of the syndrome? So number, what are the highlighters? Let me zoom it little for you. Number one, can we appreciate very nice, what is this? What is this one, this thumb? Can we appreciate broad thumbs? Yes or no? Can we appreciate broad thumbs? That is the first point. Okay. नहीं, डाउन सिंड्रोम नहीं है. कौन बोला डाउन सिंड्रोम? एक ने डाउन सिंड्रोम बोला तो 25 लोग डाउन सिंड्रोम ही बोलेंगे. इफ वन स्टूडेंट हैव टोल्ड डाउन सिंड्रोम, then 30,000 people will say down, 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 down. No, this is not down. In down syndrome you don't see broad thumbs. What is this? Can we see great toe deviated? Great toe deviated, yes or no? Can we appreciate the finding at least? Can you see? You have to, your eyes can't see, but your brain doesn't know. So can your eyes see at least right now? Number one, there is a broad thumb. नहीं dear, इसको sandal gap नहीं बोलते dear. I'm happy staphylococcus that you're answering dear, but we don't. This is not a sandal gap. Like you felt that there's a gap between the great toe and second toe, but the can we see that the great toe is deviated medially? Yes or no? Is the great toe deviated medially? Yes. Do you see broad thumbs? Like, can you see broad thumbs in this one? Yes. So this is a case of Rubinstein-Tybee syndrome. Rubinstein-Tybee syndrome. This is a case of Rubinstein-Tybee syndrome. Very, very, very important exam question. None of the student has answered this question. Means you have to revise the previous growth and development videos. If you're a newcomer, please watch my previous videos on growth and development on the Unacademy app, and as well as on this YouTube channel. Just put on the videos button and there are thousand, not thousand, but at least 50-60 videos are there. Watch them. In there I told for every syndrome there is a spotter. If I say broad thumbs and if I say great toe deviated, you will think of Rubinstein-Tybee syndrome. And in Rubinstein-Tybee syndrome, the most common congenital heart is atrial septal defect. Atrial septal defect. Okay, done. समझ में आ गया? Are you understanding? Yes or no? Very good. Very good. Perfect. Mind blowing. Mind blowing. Okay, perfect. Okay, 1 second. Okay, has everyone understood this much? Please put a like button or some button. Some button you put. Not like. It's like is not important. Some button you put here and there. That's ठीक है. समझ में आ गई? अच्छा. Actually, one of my friend is coming at my house. I'm just sharing his this one. Internet lagging. Lagging. Is it lagging? Okay. Oh, it is lagging. Okay, 1 second. Let me check. One check. There's a 5 seconds I had for lunch. Anyone? हाँ जी. Mhm. अभी आ रही है बात? I think I don't know why it's getting stuck, bro. Okay. What you had for lunch? I think Savan would have had momos for lunch. जो तो मुझे जो लग रहा है सावन के बारे में. Anyone? Yes. Anyone who? Okay. Very good. So Raghuvansh, Steffi, net issues. Yes, bro. Net issues. Now all fine. Continuous, sir. चलो अच्छी बात है. आगे बढ़ते हैं फिर. भगवान भला करे. भगवान का नाम लो और आगे बढ़ते हैं. Question number 22. Question number 22. Yes, Mr. Roti Paneer. You had biryani. अच्छा बेटा अकेले के लिए बिरयानी खाओ तुम तो. हमें तो कल तुमने छोले भटूरे खिलाए, खुद तुम बिरयानी खा रहे हो. ओह बैड. Question 22. Question 22 is which is the most common type of atrial septal defect? Question 22. पानी पूरी कौन खाता है लंच में? Which is the most common type of atrial septal defect? Anyone? Okay, Raghuvansh, please remember the like if I say the most common congenital heart disease, the most common congenital heart disease in Down syndrome is nothing but ostium primum type of atrial septal defect. Okay, the most common congenital heart disease in Down syndrome is ostium primum type of atrial septal defect. But if I talk about atrial septal defect per se, if I talk about only about the atrial septal defect, the most common type of atrial septal defect in cardiology is nothing but ostium secundum. Ostium secundum type of atrial septal defect. Are you understanding? Yes, Rachna is right. In the Down syndrome, it is ostium primum, but now it is ostium secundum in the ASD topic. That is the first point. Okay. Question number 23. Which one of the following is not a left to right shunt? Which one of the following is not a left to right shunt? The options are ASD, VSD, PD and tetralogy of Fallot. कोई बात नहीं रघुवंश. No, sorry. Sorry is not required, dear. Answer. Participate, participate, participate if you want to crack an exam. If you are here for a reason on this planet, participate. And yes, tetralogy of Fallot is not a left to right shunt. Tetralogy of Fallot is a right to left shunt, because in tetralogy of Fallot, if this is the four chambered heart, and in tetralogy of Fallot there is pulmonary stenosis, and the VSD which is there in tetralogy of Fallot is a right to left shunt. Remember that the VSD component in a case of tetralogy of Fallot is a right to left shunt. Normally VSD is a left to right shunt, but in tetralogy of Fallot it is a right to left shunt. ठीक है. Question number 24. True or false? We do not see left atrial enlargement in atrial septal defect, but in ventricular septal defect, left atrial enlargement is seen. Question number 24. What do you think? Yes or no? Yes, exportin is very right. This is a true statement. This is a very important and a very true statement, that if I talk about ASD and if I talk about VSD, if there is a atrial septal defect, you will not see the left atrial enlargement. Left atria will not enlarge, because whatever the blood is coming, it is directly shunting into the right atrium. Whatever the blood is coming in the left atrium, it's directly shunting into the right atrium. In a case of atrial septal defect, there is a very minor pressure gradient. The pressure difference is very minor. Whatever the blood is coming in the left atrium, directly shunting into the right atrium. That is why you do not see a left atrial hypertrophy in a case of VSD, but in a case of VSD you will see left atrial hypertrophy. Okay, question number 25. Question number 25. So 5 more minutes, then this class is over. Question number 25. The image shows which defect? The image shows which defect? Let's see the image. Okay, it's a very simple question. This image shows which defect? ASD, VSD, PDA, and TGA. What do you think? Question number 25. What is the best option? So this is which defect? Can you see a ASD here, VSD here, PDA here, or TGA here? So C is the best answer, of course. This one, this defect is nothing but patent ductus arteriosus. This defect is nothing but patent ductus arteriosus. So Raghuvansh, Vaidehi, Sarika, Nishi, Mani, Exportin, Rachna, and Tanu. Very right. Question number 26. The defect shown in this picture is between which two connections? The options are pulmonary artery and ascending aorta, pulmonary artery and arch of aorta, pulmonary artery and descending aorta, pulmonary artery and aorta, just aorta. So what is the best question answer for question number 26? The best answer for question number 26 is nothing but PDA and descending aorta. Very good. PDA and descending aorta. Patent ductus arteriosus is between the pulmonary artery and descending aorta. Yes. Question number 27. Now, question number 27. I am a baby who is having tetralogy of Fallot. I am a baby who is having tetralogy of Fallot. In my shunt surgery, doctor said he will connect my pulmonary artery with my descending aorta. He will connect my pulmonary artery with my descending aorta. Which shunt the doctor is talking about? Which shunt the doctor is talking about? Anyone? The options are Blalock-Taussig shunt, Potts shunt, Watterson shunt, and none of the above. So anyone? Anyone? Okay, mixed questions, mixed answers we are getting here. Okay, Exportin says Blalock-Taussig. Someone says this one. Okay. Remember, now this is a good question. What is this question about? This question is about TOF, tetralogy of Fallot. This question is about the tetralogy of Fallot treatment surgeries, basically. Yes or no? In the tetralogy of Fallot, as a treatment, if you want to do the surgeries, we have something known as Blalock-Taussig shunt, Watterson shunt, and Potts shunt, right? And in these three conditions, you connect the, what do you call it? Yeah, in these conditions, you connect the pulmonary artery somewhere. Okay, so let's see question number 27. Remember, in question number 27, you connect. Now remember one thing. Yeah, so if the pulmonary artery is getting attached to the descending aorta, if I'm attaching the pulmonary artery with the descending aorta, that is known as pot shunt. Please remember, imagine there is a pot, okay, and you are giving water, okay. This is a pot, okay, and you're giving water, okay. So there's something known as Watterson shunt, and there's something known as Potts shunt. Okay. So if you're giving water, imagine you're giving water. If you're giving water, then you basically be connecting the pulmonary artery with the ascending aorta. Ascending aorta. Remember, there is nothing but ascending aorta. Remember, ascending aorta. You will connect the pulmonary artery with the ascending aorta, and if there is a pot in the pot shunt, where are you connecting the pulmonary artery? You are connecting the pulmonary artery in the descending aorta. Descending aorta. Please remember that you're giving water to the pot. So this is our descending aorta, and you're giving water to the pot. Okay. In the pot shunt, you are connecting the pulmonary artery to the descending aorta. And if you're giving water, imagine you're giving water to the pot. So you're giving water, no, like a ascending. So when the pulmonary artery are connecting into the ascending aorta, that is known as Watterson shunt. You're giving water. And in the pot, you'll say the pulmonary artery I'm connecting with the descending aorta. That is the pot shunt. And last but not the least, we have Blalock-Taussig shunt, when you're connecting the pulmonary artery into the subclavian artery. When pulmonary artery are connected into the subclavian artery, that is nothing but known as Blalock-Taussig shunt. Blalock-Taussig shunt. Yes or no? Has everyone understood this much? Please put a like button or put a comment button that you have understood this much. This is a very important topic. Anyhow, tetralogy of Fallot is one topic we have to finish yet, and maybe tomorrow I'll take a class on top. It is a 1 hour topic, tetralogy of Fallot, all the components and complications, clinical features, and what is this TET spell, cyanotic spell, very important 5 marks MBBS question, what is cyanotic spell and stuff like that. Okay, समझ में आया कि नहीं आया एवरीवन? स्टेफेलोकोकस, स्टेफी, रघुवंश, अपना मनी, प्रिया, शुभांगी, समझ में आ गया ना? ये इंपॉर्टेंट है. Okay, let's 3 more minutes, then this class is over. Okay, question number 20 second, 30. Parallel circulation, parallel circulation is seen in which congenital heart disease? Very easy question. Parallel circulation, parallel circulation is seen in which congenital heart disease? सावन, बारिश हो रही है बाहर, जो तुम बारिश भेज रहे हो यहाँ से, बारिश हो रही है. हाँ जी, it is seen in TGA. Parallel circulation you see in TGA 1,000 times. In our previous videos we have already spoken about it. If you still don't know as a newcomer, please watch the previous videos and enrich your knowledge. For question 30, the best answer is D. Question 31. Guess the congenital heart disease shown in the picture. Let's see. Guess the congenital heart disease shown in the picture. Okay, so this is the picture, and what congenital heart disease should we guess in this picture? Anyone guess the congenital heart disease shown in the picture? Anji, what is it? A, B, C, D? Yes. So we all know that from the right side I can see aorta is coming, and from the left side I can see pulmonary artery is coming. So this, yeah, exportin is right. Sandhu, Mani, Rachna, Sama, Sarika, भर के लोग आंसर कर रहे हैं. So yes, TGA, transposition of great arteries, transposition of great arteries, है ना? Very good. Question 32. Identify the valve shown in the image. Identify the valve. Okay, I'll not give you options. You tell me which valve is this. Identify the valve shown in the image. Even girls, students do mistake in this question also. This mistake question also I have seen students doing mistakes. Is it the aortic valve, pulmonary valve, mitral valve, or tricuspid valve? Anyone? Yes, Staphylococcus. Nishi, yes. This is nothing but tricuspid valve. Tricuspid valve. Very good. We have 100 questions to cover. Let's see, we can only 32 questions we have done. Identify the congenital heart disease. Yes, this is a good question. This is a very good question. Oh, क्या option है? वाह, option देख के मजा आ गया. Okay. Anji, identify the congenital heart disease. Like, where do you see this sign? We have 10 options. Options are VSD, PDA, TG, HLHS, aortic stenosis, PPHN, trilogy, tetralogy, pentalogy, sab kuch. Full cardiology only I kept it. So the option is like, where do you see this one? Anyone? Okay. Is this a boot shape heart? बूट, हाँ सावन, तूने मुंह खोल तो दिया बूट का. ब्रो ये बूट लग रहा है तेरे को? ऐसे बूट डालता है तो? बूट शेप हार्ट इज सीन इन टेट्रालॉजी ऑफ फैलेट. इज दिस अ बूट शेप हार्ट? मेरे को तो कहीं से बूट नजर नहीं आ रहा. हाँ जी, एनीवन? एग्जैक्टली. सो मनी प्रकाश इज राइट. व्हाट इज दिस? इट इज अ गूज नेक साइन. इट इज अ गूज नेक साइन. वेयर डू यू सी गूज नेक साइन? द आंसर इज नथिंग बट एंडोकार्डियल. एंडोकार्डियल क्वेश्चन डिफेक्ट, सॉरी हो गया, कट गया. Endocardial cushion defect. So in endocardial cushion defect, you will see goose neck sign. समझ में आ रहा नहीं आ रहा? Yes, endocardial cushion defect, you will see goose neck sign. Okay, 1 more minute, then this class is over. Identify the congenital heart disease. Let's see if you can answer this. Okay, Hanji. What do you think? Anyone? The options are this one. So पहले तो X-ray देखो क्या है. Okay, हामिद delete क्यों कर रहा है मैसेज ब्रो? कोई प्रॉब्लम नहीं है डियर. ओके, फिर दोबारा सावन कूद के आगे बूट पे. ये तेरा बूट है, ऐसे बूट डालता है तू? मोटे बच्चे ऐसे बूट तो नहीं डालते. Boot shape heart is seen in tetralogy of Fallot, but this is not a boot shape heart. What is this? यहाँ पे क्या है ये क्या है ये कुछ बोलते हैं इसको, ये क्या है? ये कुछ कहते हैं इसको. TGA नहीं, एगोन स्ट्रिंग नहीं, वाटर बॉटल नहीं, नहीं 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 नहीं, कुछ भी नहीं. और कोई तुक्का रह गया तो वो भी इस्तेमाल कर लो. एनीवन? Okay, so where do you see? Okay, anyone? Okay, fine. और क्या options है क्या इसमें? Okay, so okay, let me just question number 34. The best answer for question number 34 is nothing but our. अच्छा और भी तो हैं. वही मैं कहूँ. Acha, question number 34 is not yet over. We have still more options. The answer for this question was PAPVC, partial anomalous pulmonary venous connection. I was showing you a scimitar sign, scimitar sign or nothing but sword sign, scimitar sign or nothing but sword sign, which is seen in PAPVC, partial anomalous pulmonary venous connection. तो ये है, ये वाला, ये तलवार है, ये वाला scimitar. This is very important. Scimitar sign. Scimitar sign is seen in partial anomalous pulmonary venous connection. Okay, done. Let's move further. हाँ, ये क्या है बताओ, देख लूँ पहले. हाँ जी, बहुत अच्छे खासे ऑप्शन है, देख के चक्कर आ जाएगा. हाँ जी. तो वेयर डू यू सी दिस कंडीशन, ये क्या है बताओ. ये उसके सावन के घर की फोटो है, ये नहीं, उसके घर की तो नहीं है, ये कोई एक्सरे है ये. हाँ जी. ये कैसी तलवार है. हाँ है तलवार, है, ऐसी होती है, ऐसी तलवार ऐसी होती है. तुमने खरीदी है तलवार, तुमने खरीदी हुई है तलवार, तुमको पता है तलवार कैसी होती है. हाँ जी. ये क्या है बताओ, व्हाट इज दिस ब्रदर, व्हाट इज दिस माय डियर फ्रेंड्स. हाँ जी, अंडे पे धागा. यस यस, दिस इज अंडे पे धागा. दिस इज एग ऑन स्ट्रिंग अपीयरेंस. एग ऑन स्ट्रिंग. इफ आई एम स्पीकिंग हिंदी इन बिटवीन, लेट मी नो, आई विल पॉलिश माई सेल्फ एंड स्पीक इन इंग्लिश. एग ऑन स्ट्रिंग अपीयरेंस इज सीन इन, कहाँ पे, वेयर इज इट, इट इज, हाँ ये रहा आखिरी वाला. इट इज सीन इन ट्रांसपोजिशन ऑफ ग्रेट आर्टरीज. ट्रांसपोजिशन ऑफ ग्रेट आर्टरीज, यस वेरी ट्रू. आई आई कौन बोल रहा है, एल वी एच नहीं है ये, आई किसने बोला. एल, अच्छा वो एल, अच्छा ऐसे लग रहा है. I without a caps lock, I thought it's a L. Okay, done. Question 36. Identify the congenital heart disease. Anyone, what is this? What will you answer in this picture? Anyone? Kalpana Lodhi? And the options are many, there are many options. What is this heart basically? Anyone? Raghuvansh, Staphylococcus? अच्छा सब में अच्छा आजा बेटा तू, सब में लास्ट ऑप्शन है. हामिद बताइए, इसमें लास्ट ऑप्शन है. थम जा तू, देख है लास्ट ऑप्शन है इसमें, मेरे को तो नहीं नजर आ रहा. इसमें भी लास्ट ऑप्शन कहाँ पे है. Exactly. This was nothing but box shape heart. डॉक्टर हामिद, एम आई राइट सर. हाँ जी. मनी बैग नहीं है, मनी तुम्हारे घर पे होगा, ये मनी बैग नहीं है, ये है बॉक्स शेप हार्ट. दिस इज बॉक्स शेप हार्ट. एंड वेयर डू यू सी काइंड ऑफ अ बॉक्स शेप हार्ट. द आंसर इज एप्स्टीन एनॉमली. दिस इज एप्स्टीन एनॉमली, बॉक्स शेप हार्ट. दिस इज नॉट मनी बैग. आई थिंक विल हैव अ पिक्चर ऑफ मनी बैग. दिस इज मनी बैग. दिस पोर्टली इज अ मनी बैग. ऑप्शंस बड़े सारे हैं. This is a money bag, remember, is this like a, this is like a money bag. Okay, this is like a money bag appearance. And where do you see money bag appearance? Money bag appearance is seen in, कहाँ है, again यहाँ second last option है, pericardial effusion. Money bag appearance you see in pericardial effusion. Then समझ में आ गया. Okay, I think we'll end up this class now. Question 40 तक करते हैं. Question number 38. What is this? In which condition you see the image given below, the shmoo. I asked in the previous class also. Hanji, who will tell me shmoo sign? Where do you see shmoo sign? If I don't give you the options, Tanu, Priya, Sandhu, what will you answer? Exactly, Dr. Sawan is right. Left ventricular hypertrophy. In the left ventricular hypertrophy, you will see अभी भी होते हैं money bag. हाँ हो सकते हैं ब्रो, मैंने तो कम देखे हैं, लेकिन अब मतलब द बुक सेज के होते हैं. लेफ्ट वेंट्रिकल हाइपरट्रोफी, स्मूथ साइन. हाँ क्या ऑप्शंस हैं. सो द बेस्ट आंसर इज जे, लेफ्ट वेंट्रिकुलर एनलार्जमेंट. लेफ्ट वेंट्रिकुलर एनलार्जमेंट यू विल सी स्मूथ साइन. इन अ केस ऑफ एलवीएच यू विल सी स्मूथ साइन, स्मूथ साइन. ठीक है. लास्ट क्वेश्चन, क्वेश्चन नंबर 39. हाँ ये भी आसान है. क्वेश्चन नंबर 39. आइडेंटिफाई द कंजेनाइटल हार्ट डिजीज. Okay, we have a VSD, ASD option, TGA, supracardiac, infracardiac, TAPVC. What do you think? Anyone? What is the best answer to this last question we are covering? What, where do you see? Hanji, Staphylococcus is right. Which option? हाँ ऐसे तो लिख दोगे, ABCD में कौन सा ऑप्शन मार्क करना है ये बताओ. Okay, who says option E? By the he, Priya. हाँ right. Option E is our best answer. Supracardiac TAPVC. Supracardiac TAPVC will have a figure of 8 appearance. Okay, done. That's true. Last question. Question number 40. Which is the most severe? Which is the most severe form of TAPVC? Which is the most severe form of TAPVC? The options are supracardiac, cardiac, and infracardiac. Which is the most severe or most obstructive form of TAPVC? Question number 40. The last question for today's class. What do you think, guys? Which is the best answer for this? Okay, we have Sandhu. He says A. Is the most severe form of TAPVC is the A? No. Exportin is right. Infracardiac TAPVC or obstructive TAPVC is the most severe form of TAPVC. Okay, that's it. So 40 questions are over. So thank you so much for the participation. And so we're gonna meet at 4:30 p.m. 1.5 घंटे बाद मुलाकात होगी. At 4:30 p.m. we're gonna cover from question number 40 to question number 100. So we have 60 more questions left for pediatric cardiology. एक्सपोर्टिंग सिंह मोती की तरह याद है. बहुत अच्छी बात है, होना चाहिए भैया मोती की तरह याद. तो जाने से पहले वी हैव दिस अगेन अ वेरी वंडरफुल कोट. If you are not helping to make it right, if you are not helping to make it right, then stop complaining about it being wrong. Very nice quote. तुमको देना दे, पहले मैं ही हार्ट दे देता हूँ छोटा सा इसको. हाँ जी. If you are not helping to make it right, then stop complaining about it being wrong. So this is about life, everyone. So yes, if there are problems in life, try to make them right. If you have issues, try to make them right. If you are having study problems, study, 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 and try to have a solution. So if you are not helping to make it right, then stop complaining about it being wrong. So this is a very beautiful quote. Thank you, everyone. Okay, Raghuvan says, by watching your lectures, I always boost up. Same here. Same here. So I will have my lunch now. Thank you so much for this wonderful afternoon. See you after 1.5 hours at 4:30 p.m. for the next 60 pediatric cardiology questions. And remember, if you are not helping to make it right, then stop complaining about it being. Thank you. Bye bye, everyone. मिलते हैं कल परसों तरसों शाम को 1.5 घंटे में 4